My name is Randy Bigley. Joining me on the podcast today from the Crawford County Health Department, Kate Seifert. Hello, Kate.
Hi, Randy.
How are you?
I'm doing well.
That's good. It's we were just talking before we started recording here that you've got a lot going on. It's vaccine time, isn't it?
It is.
Yeah.
Yep. We're wrapping up our back-to-school vaccines. Some people are still trickling in for that, which we're happy to see. But now we're going into flu vaccine season, so it's that time of the year to start talking about flu vaccine.
It is, yeah.
Yeah.
Yeah. So what's available?
So we have 3 choices for people at our office. There's the regular flu zone, which is a quadrivalent, so it's got 2 of the most likely A's and B's to protect you, and that's for ages 6 months and up. Then we have the flu block. That's a little bit different vaccine. It doesn't contain any virus. It's called a recombinant vaccine because it basically sends a message to your body and puts some proteins in there, not an inactivated virus.
Okay.
So it's a little bit different, and it's not manufactured using eggs like traditional vaccines are. So people with egg allergies might want to opt for that one. And then the advantage with flu block is it has 3 times the antigens compared to the regular. So that one's available for people 18 years of age and up, and we kind of recommend it for 50 and up.
Okay.
And then the third one is our high dose quadrivalent vaccine, and that's for folks that are 65 and older, and it has 4 times the antigens compared to the regular. Yeah.
Okay, yeah.
So it just gives them a little bit more protection since they might have a weakened immune system, which is natural as you age.
Right.
And so we kind of encourage the high dose for folks that are over 65, and then doctors might recommend for some younger folks as well.
Okay,
So,
all right.
yeah. We're doing clinics every Thursday.
Okay.
Give us a call for an appointment. We don't have all of our vaccine yet, so we haven't scheduled our drive-through.
Okay.
We'll do that in October. That one's really popular, and I encourage people, especially if they have little ones in car seats, or if you're having some mobility issues, or you just want to get done really fast.
Yeah.
Because we have really perfected the drive-through vaccine process
I bet, yeah,
over the years.
yeah.
And a lot of people tell us it's the only way they like to do it. And while it sounds strange to drive up, roll down your window, and stick your arm out,
right.
it's super easy and super fast.
Sure.
So,
yeah, you don't have to get out of the car.
why prolong the misery, right?
Right, exactly.
Yeah.
And
So
you have the COVID vaccine, I guess, available too?
we have ordered the new booster, the bivalent booster. It's not in yet, but we do have it on order, and we'll be offering that as well pretty soon too. So, and it is safe to do both at the same time if they want.
Okay.
But we also welcome people if they want to space it out a little bit.
Yeah, right. Okay.
And that's fine too, and we're happy to see them for both.
Sure, but you can do them together if you want.
You can. They have said it is safe. So, and they said that with the primary doses as well. So it's just, people need to realize you're putting your immune system to work.
Yeah.
With any vaccine, that's how it is. And you're putting your immune system to work to learn. So if you overwhelm it, you just might feel kind of cruddy.
Right, yeah.
So you're not coming down with it. Neither of those things can cause the flu or cause COVID.
Yeah.
But by triggering your immune system, that response, it's kind of like shooting blanks.
Yeah.
You get the noise, but you don't get the bullet. So vaccines are kind of like that, where they trigger your immune response to have those symptoms of fighting.
Right.
But there's nothing to fight. It's just your body learning.
Okay, gotcha. Okay.
Yeah.
Okay.
Yeah.
Okay, the assessment's out, right?
Yeah, the 2022 Community Health Assessment. We do that with a lot of the partners. The hospital, Avita, is the primary partner on that, but then we have the NMH board, the partnership, board of DG. We all kind of come together. There's about 20 of us, and we put this on, and put this together, I should say. And we're looking at Crawford County specifically. What are the things affecting the health of Crawford County, and then what does that cause? What are those outcomes? So the things that we found for our top factors, the things causing health issues, is lack of access to medical care. And a lot of people question that because we have 2 hospitals, but a lot of times that comes down to your insurance, where your insurance will let you go. And then access to healthy foods, poverty, and then a new one that we're starting to look at is adverse childhood experiences. ACEs is what they look at that. And those are traumatic events as a child
Mhm.
and how those stay with you for the rest of your life and how they can affect your health. And then lack of access to mental health care.
Okay.
And that is not anything that is unique to
Yeah.
Crawford County. That is statewide and nationally. So, yeah. And what that leads to basically is, depression, drug overdose deaths, drug use, suicide, and then diabetes and other chronic diseases. So those are all things we're going to come together, figure out some goals for the next 3 years and how all these partners can work together in the community to help improve some of those things.
It is National Suicide Prevention Month too, right?
It is. September is always Suicide Prevention Awareness Month, and we're excited at our office. We now have a new program. It's QPR. It's called Question, Persuade, Refer. It's been around for a little while, but we have our health educator now trained, and it's free. It's a 1-hour session. We're going to set up classes. You can come to our office, but what we would prefer to do is come to your workplace.
Okay.
A lot of times suicide completions are older people, often working, and if we can get more employers and supervisors of workers to recognize signs, I think that would be beneficial in our community. So we would love to come to workplaces just for an hour, give that class. It is specific for people that are not trained in mental health, and it's perfect for them. It's not complicated. We put our entire staff through it so we could understand it, and we all loved it.
Okay.
So, yeah, because, and part of that, I was looking up some statistics for Ohio. In 2020, on average, there were four people died by suicide a day.
Wow.
So it's definitely time for us to do something.
Sure, right.
And I'm really happy that our health educator is offering that to people.
Very nice, okay.
Yeah.
If someone wants information, how can they do that? If they're interested?
Yeah, just call our office, 419-562-5871. And then our health educator is at extension 1212.
Okay, all right. And if you want to make an appointment to get your vaccine.
Yep, same number, 419-562-5871, and then it will prompt you, and you can press to do a scheduling.
All right.
Yeah.
Okay, thank you so much.
Yeah.
Anything else you want to cover before we go?
No, I hope everybody comes out,
Yep.
gets their flu shot. If you don't come to us, that's fine. Go out to your favorite pharmacy or your doctor's office. But when they look at what's going to happen in the U.S., what they do is they look back at the previous 6 months at like Australia in the southern hemisphere, and they had a rough year during their winter because they're going into summer. Well, we're going into winter,
Right.
and it was rough. So they're anticipating that the U.S. is going to see peak numbers for flu this year, which I hate to hear that, and I hate to prepare for that, but hopefully we'll all go out and prevent that.
All right. Well, thank you so much, Kate.
Thank you.